Fibromyalgia affects millions of people worldwide. Unfortunately, despite its prevalence, our knowledge of fibromyalgia is embarrassingly poor, and we are so bad at treating it. I'm constantly amazed when patients present in my clinic with clear signs of fibromyalgia without ever having anyone suggest that they have the condition. But what's even more embarrassing as a fellow health professional is hearing about all the different treatments that have been suggested and tried, all trying to manage a completely different type of pain. It's no wonder that by the time that patient then comes to see me, they've already lost all confidence in the healthcare system. If you're new here, my name's Mahin and I'm an advanced practice physiotherapist specialising in pain management. On this channel, we explore lifestyle strategies and tools that help people manage pain and create healthier and happier lives. In this video, I'll let you know why we're so bad at treating fibromyalgia. Fibromyalgia is a chronic pain condition where the nervous system becomes overprotective and sensitized in response to stress, injury, or trauma. It's characterized by widespread pain, fatigue, poor and unrefreshed sleep, and difficulties concentrating or with memory. And fibromyalgia is a complex condition in the sense that the underlying cause, or more likely causes, of developing the condition can be quite hard to assess because there's no specific tests that can diagnose fibromyalgia. Therefore, it's often misdiagnosed as other conditions such as osteoarthritis, rheumatoid arthritis, or degenerative disc disease, as these structural changes that lead to these conditions can be easily seen on scans. Of course, we now know that fibromyalgia can coexist alongside other conditions like rheumatoid arthritis. But also, because of a lack of clear explanation from diagnostic tests, someone's symptoms can be unfairly attributed to normal structural findings we see on tests like X-rays and MRI scans. Findings like disc dehydration or degeneration, disc bulges, or mild osteoarthritic changes are normal findings present in most of the population past a certain age, and the prevalence of these findings increase as we get older. However, this is not to say that these findings are the cause of pain, and they definitely don't explain the other symptoms of fibromyalgia like fatigue and brain fog. This has led to a lot of frustration and confusion from a lot of my patients as they're unable to get a clear diagnosis, an explanation of why their symptoms are persisting, and also access to the different treatments that might help them. The struggles we have in treating fibromyalgia also comes from a universally poor understanding of how pain actually works. The key thing to remember is that pain's role is protection, so we need pain to warn us when something might not be right. We used to think that pain was there because of damage, so that we could do a scan and it would show the extent of the damage and we'd then know why the pain was there. We now know that this isn't the case, and most pain can exist without any damage at all. Particularly in chronic pain, when pain lasts longer than the normal tissue healing time of around 3 months and becomes chronic, then it cannot be explained by X-rays, scans, or MRIs. And this is just because there is no such thing as a pain test. So things like MRIs, X-rays, and ultrasounds will show structure and things happening within joints and muscles and tissue, but they won't tell us why someone has pain. And the way that pain works is, pain is an output of the brain. Now, this is not to say that pain is ever just in somebody's head, because all pain is real 100% of the time, regardless of what type of pain it is. But ultimately, our brain will decide whether something needs protecting against or not, and it will draw on lots of different bits of information to make this decision. So it will take in our environment around us, it will think back to past experiences, it will make predictions about the future, and using all of that information that it has, it will come to a decision whether something is dangerous and needs protecting against or not. Now, the brain may determine that lots of things are a potential threat. It's not just the structural changes that happen or the physical changes. It can also be things like stress, poor sleep, lifestyle changes, previous trauma that someone's been through. The confusing thing is, pain doesn't tell us what it's showing up for, it just shows up as pain. But ultimately, what the brain is always doing is it's weighing up whether there is more evidence for danger or more evidence for safety. If there's more evidence for safety, the brain will not produce pain. But if there's more evidence for danger, then the brain will produce pain. And this is the biggest shift in our understanding of pain over the past 15 to 20 years. And in my musculoskeletal and pain management clinics, there are 3 types of pain that often present. The first type of pain is nociceptive pain. Nociceptive pain is caused by a stimulus, so whether that is injury, damage, inflammation, tissue changes, or potentially harmful stimulus. And this stimulus activates nociceptors within our tissues. And examples of nociceptive pain are osteoarthritis, rheumatoid arthritis, rotator cuff related shoulder pain, spondylosis, etc. It's where often scans can show the structural changes that are happening, which may be an explanation for someone's pain. Now, conventional treatments for nociceptive pain that include things like medications, injections, surgeries, and tissue-targeted exercises can help. The second type of pain is neuropathic pain. Neuropathic pain is caused by a lesion or a damage or a disease affecting the nerves. And this can be things like sciatica, carpal tunnel syndrome, diabetic neuropathy, spinal cord injury, stroke, or multiple sclerosis. Now, with neuropathic pain, conventional treatments such as medications, injections, and surgeries, such as nerve decompressions, can sometimes help. But the longer that someone's had symptoms for, the less effective these conventional treatments are for this type of pain. The third type of pain, and the type of pain that fibromyalgia belongs to, is nociplastic pain. Nociplastic pain is caused by a disturbance in peripheral and/or central nervous system pain processing. So this can be chronic widespread pain, fibromyalgia, or non-specific lower back pain. Non-specific lower back pain being where an MRI is done and not a clear explanation is found from that MRI, but someone still has lower back pain. Now, nociplastic pain or chronic primary pain is pain that has lasted beyond the normal tissue healing time, or it's pain that has no identifiable cause that's found on a test. And for nociplastic pain, these conventional treatments that I've spoken about do not help, okay? So there might be some medications that may have some benefit. I'm not saying there isn't medications that doesn't have a benefit, but things like local injections or surgeries often don't help because there isn't a structural cause to this pain. This is where we need to move away from tissue-targeted and structural treatments to a more holistic approach. Now, taking into account these three different types of pain that I've spoken about, it may be that someone actually presents with a mix of all three types of these pains. So, for example, let's say that someone comes in and they've got a 5-year history of lower back pain with sciatica. Okay, so the lower back pain may be coming from spondylosis, which is kind of age-related or arthritic changes that are happening within the spine. And because of the spondylosis that's happening, there's also some nerve contact from the spine, which is causing someone's sciatica. The spondylosis is nociceptive pain. The sciatica pain that's being felt is neuropathic pain. And then let's say that this person a year ago started to develop widespread pain. That is now nociplastic pain. And the widespread pain occurs because the nervous system as a whole has become sensitized. And that's just because pain has been working consistently for 5 years with the back pain and sciatica, that actually the pain becomes very efficient at doing its job, and we start to feel pain in different areas of the body because of that sensitization of the whole nervous system. So this is an example of where all three types of pain exist all at once. So it is possible for that to happen. But the point here is that conventional assessment, diagnostic tests, and treatments are all focused on the first two types of pain, nociceptive pain and neuropathic pain. And in my opinion, this is the biggest problem we face as patients, health professionals, and as a health system, as investigations and treatments for these two types of pain do not show or typically help treat nociplastic pain. It's like trying to fit a square peg into a round hole. It just doesn't work. We can't just take the treatments that work for those two types of pain and apply them to nociplastic pain and expect them to work in the same way, because these are different types of pain that we're managing. So firstly, the misdiagnosis of fibromyalgia as another pain condition that may have more of a nociceptive or neuropathic involvement leads to treatments being tried aimed at helping these types of pain only, not nociplastic pain, which fibromyalgia is. Secondly, because conventional treatments that still make up the majority of pain treatments are mainly focused on these other two types of pain, it's assumed that these treatments will also work for fibromyalgia, and they just don't. These are treatments like medication, injections, surgery, manual therapies, and tissue-based exercises. Now, I'm not saying that medication, manual therapies, and tissue-based exercises don't work for this type of pain, because they might to a certain degree, remembering as well that there might be a mix of pain types going on. But all I'm saying is that they won't help as much as if the pain was just purely nociceptive in nature, such as osteoarthritis. Instead, treatments such as physiotherapy, focusing on values-based rehabilitation, psychological therapy, and mindfulness-based practices have been shown to be effective in managing fibromyalgia symptoms. Currently in the UK, the only medications that are recommended for chronic primary pain, of which fibromyalgia is, are antidepressants. Not necessarily because of their antidepressant effect, but because they have a dampening down effect on the nervous system, which can just help quieten down the pain slightly. Another area that's being researched at the moment is the role of genetics and the immune system in developing fibromyalgia. Recent studies have actually shown that there might be certain immune and genetic factors that contribute towards the development of fibromyalgia, which could help us better understand the condition and develop more personalized treatments. But despite these advances, there is still so much we just don't know about fibromyalgia, and our knowledge really needs an upgrade on this condition. For example, we don't have a clear answer as to why it affects more women than men worldwide, or why some people develop fibromyalgia after a traumatic event, such as a car accident, surgery, or abuse, and others don't. This lack of knowledge can be frustrating for people living with fibromyalgia as they struggle to access the support and the treatments that they need. But we can change this. By advocating for better education and awareness of the condition through content such as on this channel, we can improve our knowledge and understanding of fibromyalgia. So if you haven't already, please hit subscribe on this channel and share this video with anyone you feel it might benefit. And if you have fibromyalgia yourself, I'd love to hear about your experiences in the comments. You may also want to check out my custom fibromyalgia playlist if you haven't seen this already. This has videos on how to explain and diagnose fibromyalgia, the link between chronic stress, trauma, and pain, and also an apparently very controversial video on Lady Gaga's secret to living well with fibromyalgia. Thanks for watching, have a lovely day, and I'll see you on the next video.